Well, GBMC wants you to be kind to your voice and give it a rest. Now, steady voice changes are a common part of aging, but after many years of a fairly unchanging voice, noticeable changes start to occur in the later years of our lives. So joining us to discuss how you can assess your vocal health is Melissa Bidlack, speech language pathologist and singing voice specialist at the Johns Hopkins Voice Center at GBMC. All right, well, thanks so much for being here. So talk to us about voice disorders, and then can you describe some of the common ones?
Sure. Thanks so much for having me. Voice disorders are very common, but they're not talked about very much. They affect over 9 million people in the U.S. every year, so it's quite a lot. And we usually take our voice for granted until something goes wrong. Some of the common things that can happen to our voice include basically like an athlete getting calluses or blisters. We can get nodules or vocal fold polyps. So nodules are like calluses on the vocal folds, and polyps are like blisters. We can also burst a blood vessel in our vocal folds, and it will bleed. And there are also other things that happen in terms of how the vocal folds open and close. We can have movement disorders, such as paralysis or paresis, and we can develop functional disorders as well with muscle tension. And of course, cancers, tumors, those can occur as well.
Okay, now what are some of the risk factors?
Great question. Some of the risk factors include smoking, not taking care of your body, and then phonotrauma. And phonotrauma is actually, phono means voice, trauma means hurt. It's hurtful behaviors to the voice, such as yelling, cheering, screaming, talking excessively. Anyone also who has a significant vocal demand for their job is at a higher risk for a voice disorder. Singers, teachers, broadcasters, you name it, clergy, anyone who has to talk for a living is at a higher risk.
And so how do you diagnose these disorders?
So at our center at the Johns Hopkins Voice Center at GBMC, we work in a team. We see patients together, a laryngologist. A laryngologist is an ear, nose, and throat doctor with an extra year of fellowship training, specializing in the voice box. And I have a degree in speech pathology, but I also have a singing background. So we talk to the patient together, figure out what they really need to find out. Then we do an exam with a camera down their throat and look at their vocal folds and figure out how the vocal folds are opening and closing, if we see any bumps, lumps, or bruises, and what we can do about it.
All right, now this Friday is World Voice Day, right? Talk to us about the importance of the date.
So World Voice Day is a worldwide celebration of the human voice. It started in Brazil in 1999 and then was adapted internationally in 2002. So worldwide, different countries hold celebrations. They could be performances, they could be lectures. Some voice centers hold screenings, and we just celebrate the gift that is our voice.
All right, I love it. Well, thank you so much for the information. Our viewers certainly can contact you if they have more questions. The website information there on the bottom of our screen. We appreciate you for being here today.
Thank you so much.